Hey, it's Dr. Centeno, and I'd like to talk about the PICL procedure and what that is. So PICL stands for percutaneous implantation of the CCJ ligaments. So what does the PICL procedure treat? It's basically CCJ instability, which has lots of different names, as you can see, but these are the ligaments that hold the head on and damage to these ligaments. So these are the procedure steps. Obviously, we start with proper patient selection, then we go on to a bone marrow aspirate to collect the stem cells, and then we process all of that, and then specialized IV anesthesia, and then we place a specialized 3D printed mouthpiece in, and we place the needles and clean the area via endoscopy. Then we use a CRM fluoroscope to precisely place those needles. We then inject radiographic contrast to make sure we're in the right spot. And then we do the stem cell implantation via injection. And then the patient's given during the procedure IV antibiotics and oral antibiotics afterwards. So again, there's strict candidacy criteria based on history, exam, and imaging. We then undergo a bone marrow aspiration and then processing to get the stem cell fraction out of that bone marrow. The patient is put to sleep via specialized IV anesthesia, and this is very specialized anesthesia. A flexible endoscope is used to visualize the area so it can be injected, cleaned off, and then we can place the needle. And this is the injection route. We're going through the back of the throat area called the posterior oropharynx, through a small opening or hiatus between C1 and C2 to inject the alar, transverse, and accessory ligaments directly. It's a very technically demanding procedure, definitely the most technically demanding procedure I have had to learn and create. This is where we target our injection. And we use a specialized 3D printed mouthpiece that we really had to develop for this procedure and that we continue to evolve over time. And this gives you an idea here. This is me in one of the early procedures cleaning off the back of the throat to make sure we have a sterile field, and that has to be done under endoscopy. And then this is the placement of a long, thin needle in the back of the throat. And then we use CRM fluoroscopy to visualize the needle placement so that all of this is safe. And then we know where to inject because we want to make sure that we put contrast in to make sure that we get the stem cells into the alar, accessory, and transverse ligaments, which again is very technically demanding and really took years to figure out how to do properly. So this is the needle shown, which is, you can see the needle here going in to the alar transverse ligament. So this is accessory. This is the alar. You can see some of the transverse ligament here and there. And this is the needle on the right here going in on the opposite side. This is another patient where you can see a little bit more of the transverse ligament coming around here. Accessory ligament going to alar ligament. Accessory going to alar. So the patient gets IV antibiotics during the procedure and then orally after the procedure, and there's usually soreness at the back of the throat for a couple of days. So for more information, contact the CCJ Instability Institute at ccjinstability.com. Thanks so much for watching and have a great day.